Well, hello everyone, and welcome. Today we're going to discuss Parkinson's disease. I am Dr. Thomas Kempinski. I'm a board-certified chiropractic neurologist, as well as a functional medicine practitioner with Elite Integrative Health here in Atlanta. And so we're going to go through the outline here. We're going to define Parkinson's. We're going to discuss the anatomy associated with Parkinson's disease, or PD. We're going to discover the pathophysiology behind Parkinson's. We're going to review some statistics. We're going to look at the concepts of neuroplasticity. And we're going to end by going over some simple holistic health tips that is geared towards supporting the person and not necessarily the disease. So when we look at Parkinson's disease, this is a prevalent and progressive neurodegenerative condition. Scientists have determined that the primary neurological structure involved in Parkinson's disease is an area of the midbrain, which is in your brainstem, called the substantia nigra pars compacta. And this area is important because this is where these cells produce dopamine. And dopamine is a neurotransmitter that's needed for movement, behavior, learning, and emotion. And so it's interesting because Parkinson's disease is classically referred to as a movement disorder, but it's really much more than that, and it really affects the cognition, the behavior, the learning, the emotionality of the person involved. More recently, scientists have determined the actual cellular mechanisms involved in Parkinson's disease, which is the accumulation of a protein called alpha-synuclein. So when we look at the anatomy here, you can see the picture on the left of the screen is a profile or side view of the human brain. You can see the frontal lobe involved, and where the blue stops and the tan begins, that's where the parietal lobe is. The occipital lobe is in the back of the brain. You have the temporal lobe, as well as the cerebellum and the brainstem. And right there in the middle, where it's purple and red, you have your thalamus and your basal ganglia. And this is an important structure involved with Parkinson's disease. So as these cells in the pars compacta become involved and damaged, when we lose dopamine, it really starts to alter the function of this basal ganglionic circuitry, which is responsible for movement, cognition, learning, behavior, emotion, etc. So that's why we see the symptoms associated with Parkinson's disease. The picture on the right here of the screen is a brain that was sort of sliced right down the middle in the what we refer to as the coronal or frontal plane. And this slice or image is great at showing the basal ganglia. So you can see right there in the middle, the subcortical areas. There are groupings of nuclei. We can see the caudate nucleus, the thalamus. We have the putamen, the globus pallidus, pars externa and interna. We have the subthalamic nucleus, as well as the substantia nigra, which is what we were just referring to. I like this image here. This is a great image in reference to showing how the human body is mapped within the brain. So every inch of the human body is mapped somatotopically within the brain. And we can see here, when you look at the cortex, this can be either the motor strip or the sensory strip. And you can see that the feet and the legs are here on the inside portion or the medial aspect of the cortex. And then you have your arm and your hand is a little more lateral, and then we have our face and head out this way. So on the right you can see leg, arm, face, and here are those basal ganglionic structures again that we just talked about, your putamen, your globus pallidus, here's your thalamus, your subthalamic nucleus. The substantia nigra is not being shown, nor the caudate nucleus. And but you can see that the somatotopic maps hold true in these positions. So this is where it becomes interesting. Let's say you have alpha-synuclein pathology that affects this area here. Well, that's your arm area in that somatotopic region of that nuclei. And so what we'll see is contralateral symptoms. And so if this is the right, let's say this is the left cortex here, and this is the right, then the symptom associated with a lesion here would be on the left arm or contralateral arm. So this is a great image just to show you, and again, for your body parts to move, you can see that this is the circuitry that has to occur, because there's a lot of planning that goes into movements, even simple movements. Something simple is reaching for a cup of coffee is actually very and quite complex, just because there's muscles that need to activate, there's muscles that need to be inhibited, there needs to be a certain frequency of firing and speed and amplitude, so that way you don't overshoot the coffee cup or undershoot the coffee cup, and so forth. When we look at the pathophysiology, it's interesting. So there's a process referred to as ubiquitination, and there's a polypeptide substance within the human body called ubiquitin. And when this substance comes in contact with the protein alpha-synuclein, well, it sort of changes the protein and it makes it a little more sticky. And when it's sticky, it tends to clump together. And when these clumps clump together, those are referred to as Lewy bodies. Okay, Lewy bodies was discovered in the early 1900s by Dr. Frederick Lewy, and this is while he was working with Dr. Alzheimer, which we have all heard of Alzheimer's disease, I'm sure. And it's actually quite similar. It's just a different protein is involved. So instead of alpha-synuclein, with Alzheimer's we tend to see tau protein and beta amyloid plaquing. A little more recently, in 2003, so about almost a century later, a gentleman named Heiko Brack identified a pattern of Lewy body deposition. So this was sort of how the disease was progressing and a general trend to which this was going. And he found these Lewy body depositions in what we refer to as the synucleinopathies. And this is a term given to any disease where the alpha-synuclein is laying down pathologically. And the diseases include Parkinson's disease, of course, but also multiple systems atrophy, progressive supranuclear palsy, and dementia. Sometimes you'll hear dementia referred to as Lewy body dementia, and that's why. So we're going to go through Brack staging. There's 6 stages. It's progressive, so stage 1 is the beginning, stage 6 is the end. And it's interesting because stage 1 and 2 is what we refer to as asymptomatic, but really it's not asymptomatic because they're symptoms. It's just that the symptoms that are present are not commonly associated with Parkinson's disease. In other words, if you go to a healthcare physician across the board, it doesn't matter who it is, with these symptoms from stage 1 and 2, Parkinson's disease is not typically on the radar yet. And that's a problem. So I think across the board we need to get better at diagnosing Parkinson's earlier and seeing the trends heading in that direction. So let's look at stage 1. In stage 1, we have alpha-synuclein deposits or Lewy body formation, and they begin to accumulate in different areas of the nervous system. So it begins in the olfactory bulb, which is the first step of the smell pathway. It is also will begin to form in the anterior olfactory nucleus, again involved with smell. And then it starts to affect the vagus nucleus, the vagus nerve, as well as some sympathetic plexi in the heart, sympathetic chain, and pelvic region. So that's the anatomy. Now, what are the symptoms that are correlated? Well, the first is changes in smell. Now, this can occur with changes on one side or changes in both. It could actually, you could have smell, but it's the perception of smell has changed. In other words, you smell coffee and you think it's lemon, right? So not so cool. And when smell's affected, typically taste can be affected as well. And then when you have the vagus nucleus and nerve is largely what we refer to as parasympathetic. And then you have the sympathetic, so that these are parts of your autonomic nervous system. The autonomic nervous system is the part of the nervous system that controls the things that you do not necessarily think about, your heart rate, your blood pressure, digesting your food, those sort of things. These just kind of occur automatically, and you have 2 different sides of that system. You have your sympathetic and your parasympathetic. Your sympathetic is your fight or flight response. That's your ability to change your physiology in the presence of danger so you can run and fight. And then there's the parasympathetic aspect, which is your rest, digest, and heal portion of the nervous system. And when we affect these areas in the brain, we start to have what we call autonomic symptoms or dysautonomia. And it's very common. We see it in many disease processes. And it's typically related as normal aging. And that is unfortunately not true. So these things should not occur. And so the symptoms that we typically see with dysautonomia is constipation, sexual dysfunction, dry eyes, dry skin, lightheadedness, high blood pressure, insulin resistance, swelling of the hands and feet, bladder dysfunction, increase in heart rate or arrhythmia. You could have dizziness when getting out of a chair or bed, so orthostatic changes, and you can even, some patients suffer with syncope from this, which is passing out, and then migraines, headaches, sleep disturbance, fatigue, etc. Now, in stage 1, it's important to understand that the two most common early predictors of Parkinson's disease is actually a loss of smell and constipation. So again, loss of smell, most people don't know that they have that, and constipation, a lot of people have that. And so is that the beginnings of Parkinson's disease, or is that a gastrointestinal issue, or both? That's a good question. Stage 2. So here we start to see different areas are affected. And again, I'm not going to go through all of the anatomy. I'm not going to, I don't need to list them all. They're here. You can read them. You have your locus coeruleus and subcoeruleus complex. You have different portions of the brain they become affected. So when these areas of the nervous system are affected, we see symptoms such as the following. So altered food intake, which can lead to obesity. We see altered sleep-wake cycle, leading to difficulty with arousal and wakefulness. You can have disordered sleep, excessive daytime sleepiness, altered mood and behavior, depression, altered memory and learning, cognitive dysfunction, and a wide range of pain disorders. So you can see at this point, we're starting to dive more into the cognitive aspects of things and not so much the motor. The motor comes later. Okay, so about stage 3 is when we see the motor aspects kind of kick in. And so let's look at stage 3. Now here's the important thing. Again, stage 1 and stage 2, there's really, we're not really thinking Parkinson's at this point. We should, but we're not. Stage 3. Now this is where we have the typical features associated with Parkinson's disease. We have tremor, we have rigidity, bradykinesia, so slowness of movement, and typically it's on one side of the body first. So it starts on one side, and that sort of makes sense when we go back to the anatomy. We saw that if you have alpha-synuclein pathology and the one somatotopic area of the brain, it affects the contralateral side, and that's typically how this works. Here, the first bullet point, again, you can see the different anatomy involved. If you're studious and you want to look these up, by all means, they are real areas, and they are real areas that are affected in Parkinson's disease. So the symptoms associated with this damage includes diminished initiation of gait and movement, so you start to see the freezing and slowness of movement. Subtle balance disturbance, you'll see changes in handwriting, so your handwriting will become slightly illegible, and smaller. We'll see subtle eye movement abnormalities, further dysregulation of the sleep-wake cycle, diminished memory and altered behavior. Dementia can actually start to affect you at this stage, and then drug-induced hallucinations. And so at this stage of Parkinson's, when you're actually diagnosed, typically most people are put on dopamine agonists. And we're going to touch base on medications briefly. It's just important that you need to know the side effects, and unfortunately hallucinations are a common side effect of those types of dopamine agonists. So at this point, it's very important to understand that it takes nearly 50% loss of the substantia nigra pars compacta, the dopamine producing cells, 50% loss or death of that area before the motor symptoms start to begin. It's also important to note that at this point, you're roughly 7 to 10 years into the disease process. So we have to get better at identifying this sooner. Stage 4. Here we see symptoms associated with more so severity increasing in the previous areas, as well as some new areas are beginning to be affected as well. So we see widespread and severe cognitive dysfunction. We see changes in memory, decision making. We start to see changes in emotionality, progressive dysautonomia or autonomic symptoms. The somatosensory system, is really starting to take a hit. So we see changes in gait and balance. Oculomotor eye movements are affected, Impulse control can be an issue. We start to see the tendency towards compulsive disorders, so OCD tendencies, and this can even go as severe as pathological gambling and even hypersexuality. Um, and it's important to note at this point, it's roughly, usually more than 10 years after the initiation of the disease before it's diagnosed. So stage 5, remember there's 6 stages. Stage 5, again, it's progressive. So now it's becomes, the pathology becomes more intense in the regions listed in stages 1 through 4. It extends into the insular and subgenual mesocortex and anterior cingulate regions. And these areas function as viscerosensory and visceromotor areas, and this will help regulate heart rate, blood pressure, breathing, GI motility. You'll see severe cognitive decline and impaired taste appreciation. Um, when the neocortical pyramidal cells are involved in the association areas, we really start to see balance impairment and frequent falls. So here's the interesting thing with Parkinson's disease, especially at this stage. Remember, this is a progressive disorder. This takes years. I mean, this could be a 50-year process. And so Parkinson's disease is not considered a fatal disease. It's progressive. It takes a long time to accumulate the damage. And so what we find is that most deaths occur, around 60 to 65% of the deaths in Parkinson's disease occurs from falls because of the poor stability and lack of balance. So it's important to understand that. So the 6th and final stage, at this point, it's very severe. We see severe dementia and immobility, so wheelchair bound or bed bound. Common symptoms, you'll have the masked faces or hypomemia, so sort of just expressionless face, no emotionality. You'll see very slow movements. You'll see the stooped posture, what we refer to as camptocormia. Freezing or akinesia, so just lack of movement. They'll get stuck, try to take a step, and you just sort of freeze. You'll have slowness of thought, and that's an interesting concept. That's called bradyphrenia, and that's a very real scenario. We have difficulty with swallowing or dysphagia, and weakness of the voice. You start to see a lower tone or hypophonia, and these symptoms can actually be found in any of the stages. It just depends on what areas are affected, more so than others. Again, this disease can accelerate at a range of 2 to 50 years, so it could progress quickly or it could progress very slowly, with an average of 20 years. There's really no gold standard for diagnostic imaging currently. However, I think that there's certain imaging techniques that are coming around. You have PET scans and SPECT scans and DAT scans, and there's different types of imaging that isn't just looking at structure. We're actually looking at blood flow and glucose absorption and different neurotransmitter things, and so there's different imaging techniques that are really improving upon our ability to see these things before it's post-mortem. But currently, diagnosis is largely attained through symptoms and clinical examination. So really, it's as good, your diagnosis is going to come whether or not your physician understands the mechanisms that are going on with the disease. So here's a good image. This kind of shows the different areas involved. So just take some time and review that. This is a good diagram. This is also going through the Braak staging, so you can see the 20-year prodrome here, which is prior to the diagnosis of the disease, and then the 20-year disease process following it. It kind of takes you through just the different mechanisms and some of the symptoms and pathology you would see. So here's the areas that are affected. Here's some of the symptoms that you would find. So again, just a good diagram for your records. So let's switch gears here and let's discuss what's referred to as epigenetics. Okay, so we all have our genes, and some of us are predisposed to certain things, such as Parkinson's disease or cardiovascular disease or any disease. And the interesting thing about your genetics is that it's almost like going to a library. That's, our genes. We going to a library. There's a ton of books, so we have a ton of genes, but not all of your genes are expressed at one time. Just like when you go to a library, you're not reading all of the books at one time. You are picking certain books that you want to read, and your genes are the same way. So even though you may have X number of genes, you're not expressing all of those genes at one time. And so what determines what genes are turned on or turned off, or what genes are expressed, is this epigenetics. And so it really is based upon the environment in which you put your body and your brain in. And so if you put your body and brain into a good, healthy environment, you're giving it good nutrition, you're giving it appropriate supplementation and stimulation, and oxygen and all the good things, well, then you're going to have a tendency to express more of the good genes and less of the poor genes. Now, on the opposite spectrum, if you put your brain in a bad scenario, you're an alcoholic, you smoke cigarettes, you eat the standard American diet, highly processed packaged foods, fast foods, you have, toxicity from heavy metals, this can go on and on and on. And whether or not you have the genetic predisposition for a disease or not, typically if you put your body in those types of scenarios, you will develop some disease. And so that's sort of the reality. So researchers have identified a number of scenarios that promote ubiquitination and Lewy body formation. And so here are some of them. And again, this is not all-inclusive, but here are some of the common things. You can see active or dormant viral infections, such as the Epstein-Barr virus. And again, this holds true for other viruses and bacterial infections and things like that. Chronic inflammation is probably one of the bigger things, and it's probably one of the more common things. I think most people who have a chronic illness, in fact, I would argue all people who have chronic illness have chronic systemic inflammation. It's sort of been referred to as the root of all disease, and I think that that's an accurate statement. Various metabolic conditions can do it, especially type 2 diabetes, so uncontrolled blood sugar can definitely have an effect and promote these sort of neurodegenerative processes. Stress can do it, and there's different forms of stress. We have chemical stress, we have physical stress, emotional stress, you have immune stress, oxidative stress, so there's a lot of different forms of stress that can bring about these types of gene expression or diseases. You can be genetically predisposed to increased production of alpha-synuclein and or ubiquitination. So again, that's somebody who needs to be extra cautious about their environment and their epigenetics. You could have neural and muscular degeneration, so this can occur from a sedentary lifestyle or pathology. You could have toxicity from metal or from environmental issues, and the list honestly just goes on and on. Let's briefly discuss your medications. The biggest thing is I think that it's important for everyone to do some research on the side effects of any medication that they are on. You have access to this, the World Wide Web. You can Google anything. And you should never be afraid to ask your doctor questions or share concerns or symptoms. If your doctor is resistant or makes you feel insecure for asking, then I think it's time for a new doctor. So here I posted here's an image of a peer-reviewed article from the Journal of Postgrad Med in 2004, and this looks at the long-term motor complications of L-DOPA. And if you see, I highlighted part of the abstract, and so it says here that L-DOPA is an effective symptomatic treatment for Parkinson's disease. However, after an initial period of dramatic benefit, several limitations become apparent, including DOPA-resistant motor symptoms. So these include postural abnormalities, freezing episodes, speech impairment. And then you have DOPA-resistant non-motor signs, which include autonomic dysfunction, mood, and cognitive impairment. And then you can have drug-related side effects, which include psychosis, motor fluctuations, dyskinesias. So psychosis, we're looking at hallucinations. Dyskinesias, these are movement disorders. This could turn into like a rapid, uncontrollable movement of the extremity. And then motor complications can include fluctuations, dyskinesias, and dystonias. And with dystonia, you're looking at more of a posturing, so you almost like what you would see in a stroke patient. You kind of are stuck in a position. So to me, these side effects sound a lot like the later stage symptoms associated with Parkinson's disease. So, despite maybe achieving some symptomatic relief initially, it appears to me, based on the research, that this actually progresses the disease just based on symptoms. And so it's important just to understand that. Let's look at statistics. So, a 2013 study published by Koal et al. Found that these statistics pertaining to the year 2010. So in 2010, Parkinson's disease was the second most common neurodegenerative condition in the United States. It approximately affected 680,000 people in the United States. It was estimated that the prevalence would double by 2040. And the total economic burden equaled 14.4 billion, which came out to around 22,800 per patient in that year. So very, very, very significant. This was taken from the Parkinson's Foundation, so there's the website there if you want to check it out. These statistics are probably a little more recent and current. And so we can see, currently we're looking at about 1 million Americans live with Parkinson's disease. There's approximately 60,000 new diagnoses in America per year. Worldwide, around 10 million people are suffering with PD. The combined direct and indirect cost in the U.S. alone is nearly $25 billion per year. Medication cost on average is $2,500 per person per year. And then if you have a major therapeutic surgery, like deep brain stimulation or something like that, you're looking at around, up to maybe 100,000 per person. So again, it's a very significant disease, and it's affecting many people, and there's a large burden associated with it. Well, let's switch gears and let's discuss a concept that's relatively new science, and this is neuroplasticity. And so this is essentially the brain's ability to reorganize itself based on the environment that you put it in and the stimulation that it receives. So this is very profound, and it's very cool for us because you're not stuck with the brain that you have, and we can actually get the brain to learn new things and to take over functions of quote-unquote dead areas of the brain. There's even a concept of neurogenesis that's being recognized where the brain tissue can actually regenerate. So all very good things, especially with someone who suffers from neurodegeneration, because when the plaquing occurs, that scar tissue or protein accumulation takes over the functional tissue. So essentially it becomes a dead area of the brain. And whatever area that brain served for function is going to be affected. And if you can get that back, and we know you can. We've seen it with stroke cases. With appropriate rehab, we can get back appropriate tone of a muscle or movement of a muscle or coordination of a muscle. So we know that this is real. And there's a lot of research on it. So feel free to read this. There's a lot here. I'm not going to go through all of it. And this leads us into sort of my specialty. I am a functional neurologist. And so this approach of functional neurology it's a clinical approach, and it utilizes a thorough neurological examination, no different than any other neurologic examination. We're not making anything up or creating new tests. It's all, your standard neurologic assessment, but it's looked at in, I think, a different set of lenses. We're looking at more so function and less just aberrant structural damage. And so we look for subtle signs and imbalances. So we look for overactivity or underactivity, or one side, different than the other. And your evaluation includes a typical motor exam, sensory exam, balance assessment, looking at cerebellar vestibular function. We do a thorough eye movement evaluation because that's very important. In fact, eye movements is probably the best window into brain function. We look at cranial nerve testing as well as cognitive assessments. And then from there, based on our neurologic evaluation, we provide specific brain rehabilitative therapies based on the principles of neuroplasticity, so trying to activate and reorganize the tissue with appropriate stimulation. And our patients are monitored real time, so we check the autonomics just to make sure we never exceed metabolic capacity, because that's when you can actually do harm and create more damage. And then Once we feel that the patient's ready, we prescribe home therapy that's specific to the individual, which is very important. These things cannot be generalized. They have to be specific to the person and as the person changes. So every time you see somebody, their brain's a little bit different than the time you saw them before, and you have to take that into consideration. So the key is to understand that no two cases of Parkinson's disease, or any condition for that matter, are exactly the same. Therefore, brain rehabilitation must be specific to the individual at that time. And you have to select the most appropriate therapy, so there's some specificity. And you need to understand how that therapy is going to attain the desired results. Functional medicine, I'm also a functional medicine practitioner, and this is a clinical approach that uses a thorough laboratory analysis to determine metabolic dysfunction. So examples of this could be blood sugar dysregulation, autoimmunity, infections, inflammation, cardiovascular risk, liver, kidney, gallbladder dysfunction, anemia, and really much more. Thyroid function. So we could talk about all the different possibilities. And the treatment intervention includes a combination of lifestyle changes, including physical activity, stress management, clinical nutrition, and practitioner-grade supplementation to restore balance of the entire system. So here's an example. I like to run just an initial baseline lab analysis. I feel like nowadays people are getting less and less labs run as part of their checkup, and I think that's a problem because we sort of miss the things that we don't check. And so our initial panel, we look at 65 different blood biomarkers, and then we see what we see. And we go from there and we make our recommendations based on the labs that we run. And of course there may be additional testing that we need, but I think it's a great start to identifying some of the issues going on. So let's talk about some simple holistic health tips. Again, these are things that you can do on your own. You do not need to see a physician to do these. You can make these changes starting right now, and they can have a positive impact on your health, quality of life. They can slow down the progression of neurodegenerative diseases. They can even reverse the damage done in those sort of diseases. So you have nutrition, supplementation, exercise, and brain stimulation. Again, this is not an all-inclusive list, but it's a good start. So nutrition. Here's a good infographic. This is 9 brain superfoods. Again, not an all-inclusive list, but it's a great start. So you see cold water, fatty fish, chlorella, hemp seeds, grass-fed beef, egg yolks, walnuts, berries are a big one, avocados are a big one. So what you're going to see is with the fatty fish, the beef, and the avocados and coconut oil, good fats. Fats are huge. You got to get them into your diet. They make up the majority of your nervous system, and you need them. So you got to get them in. Berries actually have a huge impact on your cognition, and I have some research. And again, everything that's in this presentation, you're going to see the references at the end. This is all peer-reviewed. I'm not making this up. This has been studied with peer-reviewed research. And I have some articles on both avocados and berries, blackberries, blueberries, raspberries, and the changes they can have in the brain. So here, I'm not going to read these to you, but you can see, obviously, we have one here on blueberries and increased neuroplasticity. We have a research paper here, again, blueberries with working memory, cognitive improvement. Let's see, this one here, again, this is berries, and then this one down here is avocados. So avocados increasing lutein and showing cognitive health in the aging population. So improved cognitive performance. So check those out if you want to get the articles. Again, you can get them from the reference page or from here. So when we look at supplementation, there's 3 things we're going to stress today. And again, going back to nutrition, guys, just adding those foods in will have a profound impact. But eliminating the poisonous foods that you're eating is also a must. Okay, so let's start by adding some good things in, and then we can work on removing some of the toxic things. But you start by adding the good thing in first. Same thing with the supplementation. There's 3. Now, is this all of the supplements that could be beneficial? Absolutely not. But here's a good start. Omega-3s, absolutely huge. You need these good fats. Again, they make up the majority of your nervous system. You absolutely need them. Vitamin D is another one. A lot of research on vitamin D. Reduces inflammation, boosts the immune system. There's been research with this and cancer. There's been research with vitamin D and mental health disorders, depression, anxiety, schizophrenia, bipolar disorder. And then there's CBD oil or cannabidiol. This is a hot topic right now. Very, very cool stuff. A lot of research on this. Very good results and systemic results. So it's not just about inflammation and pain. I mean, they're showing CBD oil is helping with a ton of things. So again, omega-3s, we talked about it making up majority of the nervous system. Research supports the notion that omega-3 supplementation can reduce inflammation and pain, promote healing. And here's the kicker, neuroprotection. So if you supplement, there is a cumulative effect and it will protect you if you ever sustain a head injury, which is very, very important. So here I provided an article from the Journal of Neurotrauma in 2011. And this says that we found that DHA supplementation, which elevates brain DHA content, normalized levels of brain-derived neurotrophic factor, synapsin, cyclic AMP responsive element binding protein, and calcium calmodulin independent kinase 2, and improved learning ability in rats. So this is a good article just showing how the omega-3s can help with brain function. Vitamin D. Again, we just talked about some of this here. Again, I put another article here. Feel free to go through that. This one showed that, let's see here. So there's a significant association between low serum vitamin D and Parkinson's disease, suggesting that elevated vitamin D levels might provide protection against Parkinson's disease. And so here's the interesting point. How many of you have been checked for vitamin D? And if you haven't, well, you need to find somebody that will check it for you, because it's important. Cannabidiol. So CBD acts in the endocannabinoid system. This is a relatively new concept. The endocannabinoid system has receptors located all throughout the body with a high concentration of receptors located in the brain. And there's an extensive review of the literature that concludes that CBD is neuroprotective. It reduces neuroinflammation. It supports neural repair mechanisms. It enhances neurogenesis, and it improves cognitive function. So my wife actually just did a live health seminar on cannabidiol, and so you can check out the recording of that video by visiting the YouTube channel here. Exercise. Exercise is huge. Movement is the key to life, and it honestly provides the greatest form of stimulation to your nervous system. You got to do it. It's so important. And the research has supported this for years. This is not a new concept by any means. Exercise completely changes your physiology. And what we're finding is that high-intensity interval training, or HIIT training, has gained a lot of publicity recently because of the benefits that you can receive in minimal time domains. So we're not asking you to go out and run 30 miles a day to achieve benefits. I mean, literally, you're looking at challenging the system. You want to push the body hard for 20 seconds and then rest and then do it again. Okay? And with HIIT training, they've shown that there's an increase in growth factor, which is going to help repair tissues, as well as brain-derived neurotrophic factor, which does the same thing just in the brain. Here's an article from Neuroscience, Journal of Neuroscience 2014, that said physical activity has been demonstrated to diminish age-related brain volume shrinkage in several brain regions, accompanied by a reduction of age-related decline in cognitive functions. So here's the goal. Let's shoot for 10,000 steps per day. Again, this is a progression, so if you're at 5,000 steps right now, I don't expect you to just jump right to 10. You sort of work your way up. And then your goal should be to mix in between 1 and 3 days of this HIIT-style training, okay? Brain stimulation, it's huge. You got to do it. So, cognitive exercises, I mean, things you can do simply. Crossword puzzles, Sudoku, luminosity, things that challenge the system. Not things that you can get good at, like solitaire is something you can get good at, right? The first time you play it, if we did a functional MRI, we might see that the whole brain lights up. But if you've been playing solitaire for 20 years, well, then the brain's not going to light up anymore. It sort of just becomes, muscle memory, if you will. And so we need to challenge the system constantly. And, the brain likes novelty, so trying new things. We can do memory training, music therapy, and dancing is huge. Um, you can learn a musical instrument, you can learn a new language, you could take a different route home, don't rely on your GPS. You could read and continue to learn and just challenge yourself cognitively. That's really, really so important. And here are some additional health tips. Um, 8 hours of good quality, uninterrupted REM sleep per night. So here's the thing, guys. You know, if you're waking up 4, 5, 6 times a night, well, you're probably not getting into the REM sleep, and you need to get good sleep. Sleep is when you heal. It's when you close down the amusement park and you clean up all the trash. Okay. Otherwise, trash will accumulate, and you're going to end up with chronic disease. Adequate water intake. The goal here is half your body weight in ounces per day. So it's easy. Get a container that measures ounces and measure your weight. Divide that by 2, and you'll figure out how many ounces of water you should get per day. Now, again, this is a progression. You don't want to just jump right to the maximum amount because you'll be in the bathroom all day. And the other thing to consider is that dehydration is a very real issue for people. And if you drink coffee and if you drink sugary drinks or you drink sodas, these things dehydrate you to the point where it's almost impossible to drink enough water to rehydrate you. So something to consider. Get adequate water in, but maybe let's eliminate some of the other beverages that we consume. Meditation, deep belly breathing, yoga, all great things. Really stimulates the brain. Deep belly breathing is good for increasing parasympathetic activity, also good for core stability. And then techniques to manage stress and calm the mind. So a lot of us, everyone deals with stress. We all have stress. We have work-related stress. We have family stress. And so the key is to put the brain and body in a better state of health so it can manage the stress better, and to be aware of stress and that it's a real thing. So figured I would leave you here with this. I'd like to thank you all for your time. And here's my family here. It's my wife and my little girl. And so I hope you enjoy that. Here is our practice information. I practice with my wife, Dr. Cynthia. And this is our address, our email, our website, our phone. Feel free to reach out to us. We're more than happy to always answer any questions and to work with you. We see patients from all over the world. We do long distance functional medicine, healthcare, and then of course we do our functional neurology and chiropractic services locally. And we do accept long distance patients for those services as well. So here are the references. And that's all she wrote. Thank you for your time.